Good afternoon and welcome to our next series of Women Health Education Made Simple. Today we're going to be talking about recurrent pregnancy loss. My name is Dr. Modupe Tunde-Byass. I am an obstetrician and gynecologist practicing in the North York area. I'm also the co-founder of Women Health Education Made Simple. This is defined as the occurrence of 3 consecutive pregnancy losses before 20 weeks of pregnancy. It affects 1 to 2% of pregnant women or individuals. Individuals who have had recurrent miscarriages, they are at a loss about the cause, the likelihood of recurrence, and if there is any treatment that may prevent another loss. It's important to seek help and to do so with the right healthcare provider. What are the causes of recurrent pregnancy loss? Most times the cause is unknown. However, there could be chromosomal abnormality. Sometimes this could be due to something as simple as untreated low thyroid hormone or uncontrolled diabetes. We also know that there are some anatomical problems affecting the formation of the uterus, and there is something called antiphospholipids antibodies syndrome. Apart from seeking the right health provider, you would need to be examined and some tests needs to be performed. At a minimum, you need pelvic ultrasound, blood test for anti-cardiolipin antibody, and also lupus antibody. Your thyroid, of course, is important to check that. And the chromosomal analysis of the pregnancy that has been lost. Rarely, we also do karyotyping in the couple who are experiencing recurrent pregnancy loss. The diagnosis of recurrent pregnancy loss is distressing. Having to wait for 3 losses to be investigated. It brings me to the point that if you have experienced 1 or 2 losses, it's important to speak to your healthcare provider if there are things that can be done. It could be something as simple as pelvic ultrasound for reassurance or screening for subclinical hypothyroidism. In terms of treatment, you want to think about how can you even prevent this from happening. Even though we don't know all the answers, there is a body of evidence that progesterone support in early part of the pregnancy might be useful. There's been also research around aspirin, heparin. Treating hypothyroidism and controlling a poorly controlled diabetes is also important. Thank you so much for listening, and please continue to follow Women's Health Education Made Simple on all social media handles. Thank you.